Thank you, Liz. Okay, Mackenzie.
Good day, Board. My name is Mackenzie Wilson. My pronouns are they, them, and I come today as the community organizer for Decarcerate Sacramento, the Sacramento Tenants Union. And we're all members of your local Community Care First Coalition. I will name my frustration with the fact that thousands of voices have been brought into this room between DS, the People's Budget Survey already doing that community engagement, and now adding to that number voices from a report that DS and Care First helped publish about what services this community wants and doesn't have. Simply how many more voices are needed for y'all to start to listen. Today I will read quotes from these community members about their about the lack of access to opportunity and choice and the ability to live. Before I begin, we analyzed your budget and we want to remind you that Sacramento County spends 10 times more of the general fund money on the sheriff than mental health, $12 per person on public health, and $201 per person on the sheriff, and that 70% of our general fund is going to the criminal legal system and only 5% on health services. So, on access to primary preventative and behavioral health, people spoke on jumping through hoops and having to fail first to get access to services. It takes a lot to get what you need, and some people don't have the time to jump through those hoops. Like me, I have mental health issues, and I can't write, and there's a lot of questions back and forth, and I just want to get it down from a currently unhoused person. It's poor. For medical care, it's like pulling teeth. You have to be bold. You have to speak up. Even with my doctor, if you don't, they're going to treat you like crap. They're not going to give you anything. They're not going to take care of you right. Another quote, it's hard to get on any list, and they have certain criteria, so you can't have any income to get in the program. That's from a person recently released from downtown jail. I'm thinking about my younger brother. He had a job, and the job didn't offer health care insurance benefits. The cost of going through the exchange of the Covered California was so high that he wouldn't be able to have a whole lot of funds left over after his paycheck if you signed up for that. So he went without without health insurance for a while. Mind you, he was also taking methadone. There would be times that he couldn't afford to pay for the methadone clinic to get what he needed, so he wouldn't get sick. You've really got to fail first in order to get any type of assistance. So when he lost his job at the crush to his ego and self-esteem and mood of being unemployed, not having that structure and that purpose, and but it did get him on Medi-Cal because he could finally be so broke enough to afford it or to have access to it. So where he's able to then get the meds he needs and the treatment he needs. But it seems like that's a trap. Folks have to really fail before they can get any type of assistance to try and keep their head above water. Barriers to healthcare, lack of resources. My son, I literally know people who will go to jail just to get readjustment on meds because they feel like they don't know how or they don't have any other place they can go. And then when they get out of jail, they think they're healed, but they're not. And then they end up back in similar situations and back in jail. And it's not because they're criminals or anything. It's just that they're looking for a specific resource, whatever it may be. So by the time that they get whatever they needed, it's going to be it's not going to be very much anyways. And when they don't transfer back out into, I'm going to scoop onto emergency and crisis response. We're having a very hard time, especially around mental health. We just don't have, I see my time's up. We just don't have the services. They're just leaving people out to try and figure it out. Navigating the 211 system is so hard when you know that the constant go-to is not accessible. We just don't have the wraparound services and the housing available at this point. Simply, please read through the report. Please begin to make investments into this community. Please listen to the thousands of voices that have come into this room. And please pay attention to the fact that your general fund is still continuing to uplift carceral and punishment-based systems rather than actual reinvestment into housing, healthcare services, mental health services. Stop paying for the overhead and just give people the things they need.
Thank you, Mackenzie.